The following is a commercial program paid for by Landmark Recovery of Knoxville. The opinions and views expressed belong to its sponsors and are not those of Nexstar Incorporated, this station, or their affiliates or employees.
Hi everyone, I'm Summer Dashe. Welcome to Health Matters. How often do you think about your health? Making sure we are tuned into our mind, body, and soul is an important part of our daily lives, but all too often, many of us may fall short of staying on top of what's important. I get it. Today, we will be talking about substance abuse and how it impacts you and others around you. The experts at Landmark Recovery are here to make sure we all understand how important your mental health is and how to treat drug and alcohol abuse and about relapse prevention. We're going to be talking about how people can afford treatment, the stigma behind substance abuse. You're also going to hear some really amazing success stories from people who have gotten that help and learn more about Landmark's full treatment facility with help from diagnosis all the way to recovery. Thank you so much for joining us today. When it comes to your mind, body, and soul, health matters for all of us. Get ready to learn more about how Landmark Recovery can help. Hey everyone, thank you so much for joining us for Health Matters. I'm Summer Dashe and I am so happy to be back here doing this, especially covering a topic that is so very close to my heart. Many of you know that I had to leave my wonderful job here at Channel 6 because of a chronic illness that I have. So to come back and get to cover a topic about health is so very, very special to me. Today we are focusing on drug and alcohol recovery. I have Jessica Tate here with me from Landmark Recovery. Jessica, first of all, thank you so much for helping us get the show off the ground because it's a wonderful opportunity for our community. And also thank you so much for sharing your time with us to make sure we can get this information out to our viewers. We really appreciate your time.
Thank you for having me.
Yes, absolutely. So before we get into it, really shocking statistic that I want to share with everybody right now. More than 15% of all adults in the U.S., that's about 40 million people, have a substance use disorder. I did not realize this number was so large. So that's according to the latest national survey on drug use and health. That means drugs or alcohol causing clinically significant impairment. That's the definition of this. So how many of those people actually do go ahead and seek treatment?
Sadly, the majority of these individuals do not seek treatment, do not receive help. You know, statistics show that less than 7% of people actually seek or receive treatment that they need.
Wow. And why is that? I think that's probably a multi-part answer that we're going to have here, but we've got 15%. That's a big number, and you said only 7% are actually going forward and seeking treatment. Why is that?
You know, I think there's so many reasons. I think fear being the biggest one. Addiction is oftentimes what individuals know. It's the life that they've led for a very long time, and change, though it is the only constant that we have in life, is actually very scary. And on top of that, addiction is very heavily stigmatized. There are a lot of social stigma surrounding addiction, and that can lead somebody to be embarrassed and not seek treatment.
What would you tell people who are watching right now, who are hearing these numbers? They're maybe surprised by this and maybe know someone or love someone, or they are going through this themselves. What would you tell them about that?
Boy, change is scary, but living a life in addiction is even more scary. There is help out there, and we don't have to live in this hopeless place, because oftentimes that's what we see. That is a big barrier for individuals to seek treatment, because we feel hopeless and we feel like things aren't going to improve. And so my biggest message would be, like, there is hope, and it does get better if we take that first step.
When we talk about stigma, because it is something that we do often hear in relation to people who are going through an addiction, we hear about that stigma. What is it?
You know, I think when people think about an addict, everybody has this stereotypical person in their mind. It is, and I hate this word, so forgive me, but that the junkie on the corner, right? And unfortunately, that's not true. Addiction affects every single person. I don't know anybody that hasn't been touched by addiction in some form or fashion. Either they've personally been afflicted with it, or they know somebody who has. And addiction doesn't look like it used to. It affects everyday people like you and I.
What do you mean by that? Addiction doesn't look like it used to. How has it changed over the years? What have you guys seen?
I think, you know, most pressing, what we've seen is a big change about alcohol use, right? Like, we have way more alcohol use and way more alcohol addiction than historically we ever have before.
Do you think that has something to do with the pandemic at all? What do you think is behind that?
I think it absolutely contributes to it. I was having a conversation earlier today about how the pandemic impacted alcohol use for so many different reasons.
Yeah.
We are maybe the functional alcoholic who, for X amount of hours a day, had to have barriers in place. We had to be sober. There was the accountability of, if I am impaired, somebody's going to be able to find out. And with the pandemic, that was removed. I no longer have this accountability.
Right.
And now I'm isolated too. And I'm not getting that social connection that I need.
Right, right. How did you guys get around that a little bit when we were going through that? Because you guys were doing a lot of, I mean, there was virtual stuff going on. It was tough.
So healthcare didn't stop.
Right.
Unfortunately, fortunately or unfortunately, healthcare continued. So we continued operations, and we put a lot of infection control practices in place to make sure that our staff and our patients were kept safe. We did continue to offer virtual options for those that were in outpatient. So the individuals who graduated from our program and were stepping into our outpatient programs could continue to receive the treatment and not be at risk.
Right, right. And I think it's so important too for people watching that you really understand what this kind of treatment looks like. So I know we've got some stories to share with you today when we're talking about stigma. Do you think it helps to hear from others who have been through this, to break that a little bit?
Absolutely. To be able to see somebody who is like a real-time person,
right,
and to challenge that stigma that maybe other people have in their mind, like this is somebody who looks like me, who has experienced similar things as me, and here they are giving me a message of hope.
Right, right. So on that note, on a message of hope, we do have a story I want to share with you. This is Rob's story of recovery.
The night before I went to rehab, I was sitting there trying to figure out how things got so bad. How could I have lost myself this much? I'd been using for 15 years, and during that time, I'd gotten to this point where I knew that I couldn't go on like this anymore, but I also knew that there was no way I was going to be able to do anything about it. So I wanted to have hope, but I wasn't even fully there yet. I just didn't want to live like that anymore. And then I got into Landmark, and I was full of a room full of people who were like, yeah, me too. The strongest thing you can possibly do is give up trying to do it on your own and ask for help. It saved my life. I didn't even know if I fully wanted to go to recovery. I didn't know if I needed to. I kind of thought I could do it on my own. And I had to throw that all out the window and just recognize that I'm powerless over this, but together we can do this.
Recovery is strength.
Recovery is courage.
For me, recovery is freedom. My road to recovery was full of pain.
It redeemed me from a life of pain, darkness, and complete oblivion.
Recovery showed me a strength I didn't know that I had.
Addiction is part of my past, and my past has been redeemed.
Find the courage to live a healthier you.
For strength against addiction, visit landmarkrecovery.com
or call 866
Landmark today.
Hey everybody, welcome back to Health Matters. I am here with Jessica Tate from Landmark Recovery. I want to make sure we touch on this today. Affordability. When we think about someone going to seek help and going to rehab, I think a lot of times we think, I can't afford that, that's going to be way too expensive. Landmark sounds like it is making this really an affordable option for a whole lot of different budgets. Talk to me about that.
Yeah, Landmark really tries to remove the barrier. There's so many reasons why somebody will not seek treatment. Either they're afraid, they don't have child care. The biggest one is I can't afford it, without even actually knowing what it costs. Yeah. So Landmark tries really hard to cater to an individual's needs. We don't want cost to be a reason that somebody doesn't get help and somebody doesn't get to heal. We want everybody to be able to afford that opportunity. So we work really hard to remove that barrier. And I think when we think about cost, we can't just look at the monetary value of treatment and what it's going to cost, or the monetary value of addiction. Addiction costs far more than the cost of treatment. It has an impact to our work, to our home life, to our health. And the cost, if you really break it down, is so much more significant.
Yeah, and when you were talking to me a little bit about that during the break, I mean, it gave me chills when you said that the cost of addiction, when you break it down, is far more than the actual price tag. So I think that's something that's so important for people to really consider. If you are watching and you're concerned about that, think about what Jessica just said, that the cost is far more than the actual price tag. That's great. Also, when we talk about rock bottom, I think that's a term that we've all probably heard. what does rock bottom really look like?
You know, it's one of my favorite topics, so thank you for asking.
Yeah.
There's this common notion in the addiction world that I have to hit rock bottom. Rock bottom is a myth, right? Like rock bottom, if you really think about it, what is rock bottom? It is different for every single person. What stops people from changing is this idea that things have to get so bad, and that's not true. The only thing that has to happen for me to desire to change is that the consequences of my action are now outweighing the benefits that I was getting, right? So like the cost of my addiction is now costing me more than what I thought I was getting from it.
Right.
And so I that's the message I want anybody to hear. I don't have to hit rock bottom. You don't have to hit rock bottom to change.
Well, it's almost like by saying rock bottom, it's putting a measure on how bad you have to be before it becomes a problem.
Right.
That makes sense. That makes sense. And what would you tell people who are sitting there going, I don't know, do I have a problem? Don't I have a problem? What about these people who maybe don't realize or refuse to seek treatment? What do we do?
You know, it's very common that people refuse to seek treatment or they are unable to identify the impacts of addiction in their life. And so I think our social environment is a good barometer. So am I having complaints from my loved one? Am I having consequences of my health? And if so, if I'm not willing to see that, can I at least take the feedback that everybody around me is giving me and do something about it? But oftentimes people are scared because it is, I'm going to appear weak. I can do this on my own.
Wow.
I don't need help to be able to change.
That makes sense. That makes sense. Okay, let's go ahead and take another look at a patient story. I want to take a look at what the inpatient services look like. So we have Paul's story to share with you now.
When I came in, of course, I hate to admit it, but I can admit it today, I was broken. Depressed, didn't love myself, really didn't care. But I knew there was a better light. I guess Landmark kind of held on to me and showed me that light. The thing about Landmark is the people there, they love on you. And it motivated me and set me up to go out into the world in the way that I could really latch onto sobriety. The biggest step is the first step. And that first step is not really a step because you might walk through the doors, but literally I think I crawled through the doors. It's the strength, it's wanting to want it. There's a saying, and it never dawned on me until I got in recovery, but you got to be sick and tired of being sick and tired. There's more than sunshine at the end of the tunnel. It is a beautiful horizon if you're willing to work through it, but you have to dig deep down inside. I had to dig deep down inside and realize that person inside that I was destroying deserved to come out. Because people enjoy that person, and you just gotta really, really want it. No matter what Landmark gives you, no matter what anybody else gives you, you got to want it for yourself, and you have to ask for help. It takes a big man to ask for help. My strength is the way I feel about me, and for me, I can't love nobody else until I absolutely love myself.
You know, I love that Paul talked about that the staff loves on you. When we're talking about something that's really scary and can be really intimidating to go seek something like treatment for drug and alcohol addiction, that is so heartwarming to hear. Tell me about the staff and what Paul means by that.
You know, I have never seen anything like the staff at Landmark. We, from the very first time that somebody walks onto our campus, for lack of a better word, they get greeted with what we like to call the Landmark welcome, right? Like, you're not going to carry your own bags into our treatment center. We're going to be there with you every single step of the way. And that is something that carries through the entirety of an individual's treatment program. Many of our staff members have experienced addiction and recovery themselves. And so there's a different level of understanding and compassion, and they've been there. They can help walk alongside you.
Right.
In addition to that, we offer double the number of individual therapy sessions and hours than any other treatment facility, and the group therapy, double the industry standard.
Wow, so it feels like a lot more individualized treatment.
Absolutely. It is very structured. It's a very structured process, a lot of therapy, and really getting and digging into the root cause of the addiction.
Wow, that's wonderful. And for folks who are watching again, I want to dig in a little bit further onto the price, because I think watching something like Paul's story, if you're out there and you're going, gosh, that looks wonderful. I would love that kind of help. And what you have said just sounds like a gift. So for folks who are wondering about that price, what are the pricing options? Do you take insurance?
We do take insurance. When it comes to pricing options, again, we work with the individual. To give you a price tag would be unfair and a disservice to any person out there seeking treatment, because we believe that treatment should be individualized. And with that means working with an individual's insurance plan, making different payment arrangements with them, and just catering to what the individual needs.
So very individualized payment pricing for each person who comes there. And there, we're talking about individualized approach to therapy, and you're doing an individualized approach to a payment plan.
Absolutely, really helping that individual.
Awesome, wonderful. And we've got some viewer submitted questions. We're going to talk about those next here on Health Matters, so stick with us. We've got Jessica Tate here with us from Landmark Recovery. We're answering your questions when we come back.
Recovery is strength. Addiction feeds on insecurity and weakness, and it thrives in the dark recesses of the mind. My recovery journey, from detox to present day, has empowered me to go to those dark places and confront what I find there. Recovery showed me a strength I didn't know that I had, and it also allows me to live life on my terms without turning to substances as an escape. For strength against addiction, visit landmarkrecovery.com or call 866-LANDMARK today.
Welcome back to Health Matters. I am here with Jessica Tate from Landmark Recovery. We are talking about some viewer submitted questions now. Many of our viewers wrote in, and a lot of them had a similar question, which is, if I go into treatment, how long will I be in treatment?
Again, this is not a one-size-fits-all. Treatment is based on the individual, and what one individual needs may be different than what another individual needs. Most individuals come in needing detox, so we experience those physical withdrawal symptoms, and so we have to safely detox them from that. Generally speaking, that part of the program is going to be 5 to 7 days.
Okay.
And then from there, they will transition into our residential program. On average, they could expect to stay 25 to 35 days in that program. And then they have the option to continue into our outpatient program.
Okay, and of course, recovery never ends.
Correct.
That's something you continue with. And one of the things that I'm sure is a very useful tool is therapy. You are a therapist. This is your wheelhouse. I know you're excited to talk about this. And I really want you guys to listen up to what Jessica has to say, because this is a huge, huge part of this. Landmark does not just treat addiction. You guys are getting to the root of what is causing that addiction. You said that that's a symptom, that's not necessarily the problem. So tell me a little bit about what addiction therapy looks like.
Absolutely. So like we previously talked about, at Landmark Recovery of Knoxville, an individual gets double the amount of individual therapy hours than they would typically get at a different treatment facility. During therapy, it's very similar to what you and I are doing. It is a conversation, right? Good therapy is a conversation that is designed to get to the root cause of addiction. Everybody thinks substance use is the problem, right? And it's not. Like we were talking about on the break, substance use is a symptom of the problem. Oftentimes it's because I'm experiencing depression, I'm experiencing anxiety, and substance use is how I cope with it. It is something that helps me to deal. And so therapy really digs in and gets to the meat of the issue so that we can learn how to more effectively cope with it.
That makes sense. We've got someone who has been through this therapy, because again, I think it's so important to hear from people who've gone through this. If you're watching and this sounds really scary, promise talking to Jessica is not scary at all. She's wonderful to chat with, so don't be afraid, but take it from Kyle, who has been through this before.
I thought I was just destined to be homeless and die on drugs. For me, it was all about the one-on-one therapy I had with the therapist provided by Landmark. They really helped me look at the patterns I had throughout my life, the trauma I had been through along that path, and kind of helped me pinpoint where exactly, the trauma plays in, where exactly, why I'm using in the first place, like why I'm seeking drugs in order to feel okay about myself. I kind of learned along the way through my stay at Landmark how to build positive relationships with other people, and that continued after I got out of Landmark. And that's something that really stuck with me and helped me To this day, they said connection is the opposite of addiction.
Okay, so Kyle mentioned trauma, behavioral patterns. This is something that I understand goes into therapy. So what does that look like?
I think that's such a loaded question, right? Like, trauma is this heavy word. People hear the word trauma and they shy away from it. They run away from it. When in actuality, trauma is completely subjective. What is traumatic for you may not be traumatic for me, and vice versa. Trauma is how we kind of internalize an event. It is our reaction to an event. And these things happen to us, and then we develop behaviors and patterns as a result of it. Oftentimes people use as a means to cope with that trauma.
That makes sense. You know, one of the things that I say when I talk to other chronically ill people like myself, I say that sickness is not a competition. So I think it probably is similar to that, whereas one person's trauma may be, you know, not as big of a deal to someone else. So it really is going back to that individualized approach, it sounds like.
Absolutely. Again, trauma is subjective.
Right, right. Makes sense. And when we're in therapy talking about those sorts of things, how do you approach that? What can we expect if we're seeking treatment going through that program?
Again, I don't think it's as scary as it seems. It's hard.
Yeah.
Doing the work is really, really hard. So I think that is what we can expect. We are going to have to do the work. We can't just make the decision of, okay, I have a problem, I need to change, but we have to commit to that change. We have to commit to doing that work and recognizing that that is the beginning of my healing journey.
Right, that makes sense. Thank you so much. And up next, we are sticking with Jessica here from Landmark Recovery here on Health Matters. We're going to talk about specifically what Landmark Recovery can do for you.
Recovery is courage. In a culture where there's a stigma around recovery, I've learned to have the courage to tell my story to inspire courage in others. I know one of the hardest things to do is to have the courage to start recovery. I've gotten to live the life of my dreams simply by having the courage to say, it is time for a change in my life. Find the courage to live a healthier you by visiting landmarkrecovery.com or call 1-866-LANDMARK today.
Welcome back, everyone. I am here with Jessica Tate from Landmark Recovery, and we have taken some viewer questions throughout this Health Matters show. And one of the things I think our viewers really want to know is what Landmark Recovery can offer them. We've talked about therapy, but what can Landmark Recovery offer them? What does this look like?
So like we talked about, residential treatment is just the beginning. It is the very first step in somebody's journey after they've made the decision to change. Once they complete residential treatment, they are able to continue into our outpatient program where our staff will continue to walk alongside them every single step of the way. I think when we talk about what treatment can offer, it's more about what can I gain from recovery and what is recovery. Recovery is about hope. It's about hope for a better tomorrow. It's about hope for change. Hope for who I want to be, hope for my family. It's about freedom. It's about learning, who do I want to be? How do I get there? And the staff at Landmark Recovery are going to help you determine that. They're going to help you figure it out. They're going to help you figure out what are my triggers? What are the things that maybe are going to increase my cravings? They're going to help you figure out how do I deal with that so that I can then continue on my journey and be who I want to be.
I love talking to people like you who are so very clearly passionate about what they do. It is an absolute gift to hear from people like you. You have such passion. Tell me what's behind that, because you've seen these success stories. You've seen how this goes. What makes you so passionate?
Oh, so many things. Addiction is very near and dear to my heart. I am one of those staff members at Landmark Recovery who has experienced it in her life in some form or fashion. I've seen firsthand how devastating addiction can be if left untreated. And more than that, I've seen the amazing stories of hope and grace and change. And there is nothing more rewarding or gratifying to get to be a part of somebody's journey. As a therapist, I always said, like, I am not responsible for the change. Staff at Landmark Recovery are a part of the change. We are a part of the journey. But there's nothing more rewarding than seeing an individual doing that work.
Oh my gosh, thank you so much for everything you do and talking about folks who you have seen have success with this. We do have some stories to share with you about some wonderful alumni of Landmark Recovery, so let's take a look at those.
My initial thoughts on starting recovery were, well, I was terrified.
I was extremely nervous and wasn't sure about doing it, wasn't sure about succeeding in it.
I did not want to do it. I was 3 years of a meth addict, and I probably knew for about 1.5 years that I had an issue.
I knew that I had a problem.
So I didn't want to do it at all. I thought I could do it by myself. I could probably stay home and do it. I didn't need help.
And I knew that I couldn't fix it myself.
So I just jumped in and went for it.
I went into Landmark with absolutely no idea what I was getting into. I showed up in the middle of the night.
I would tell someone to just take that leap of faith and go for it. It's scary, it's intimidating.
I would tell someone considering Landmark to go for it. I was at Landmark for 37 days, and it was the best 37 days of my life because it gave me my life back.
What's 41 days out of 365 or the rest of your life? You know, it's not that long at all.
The other side, once you make it through, is so worth it, and I wouldn't change a thing about my recovery.
That was the best choice that I've ever made in my life.
Landmark gave me the tools to learn how to live again. They gave me the knowledge on how to deal with life on life's terms, situations that were popping up, and I was able to work through them and gain confidence in my sobriety.
Oh my gosh, hearing alumni stories, I'm sure you see these every day, but it's got to be really special for you when you see things like that.
Absolutely. It's so heartwarming, and it's again, it's a reminder of why we do the work that we do.
Yeah. So today we have talked about some stigma associated with going to rehab and addiction. We talked about stigma. We talked about therapy and what you will see if you go to Landmark Recovery and you're going through this process. And we talked about affordability. You know, a lot of people are really concerned about the price of seeking treatment. We talked about the individualized approach and that you guys will work with them to find a budget that works with you. And again, reiterate, what'd you say about cost? You said cost isn't about the money.
Right. Cost is not a reason to not go to treatment because the cost of not getting treatment is so much greater.
Yep. That was such a great takeaway from all of this. I really, really appreciate it. For folks who are watching this and they want to reach out, what do they need to know?
You know, I think the first thing that I would say is that the phone is not as heavy as it seems. Oftentimes when we need to make that call, we need to pick up the phone, it seems like it is so heavy and it's impossible to do. Yeah. It is not as hard as it seems, and I would encourage you to pick up the phone. There is a live person on the other end of the phone waiting to talk to you. You can contact them by 866-LANDMARK. You can go to landmarkrecovery.com and utilize the chat feature. It's not a robot, I promise. It is a live human being that you are talking to.
Wonderful. That is absolutely wonderful. So you're getting a person, folks. Thank you so much for sharing this and helping us get the word out to our community. If you are interested, if you want some more information, we've also got a tab on WATE.com. Click on the little Health Matters tab for more about Landmark Recovery. Thank you so much for joining us today. Thank you for taking the time to join us today. We hope you learned a lot and better understand substance abuse and the treatment options available. Please do visit landmarkrecovery.com to see how Landmark Recovery of Knoxville can help you or a loved one. I'm Summer Dash, and I hope to see you next time on our next Health Matters right here on WATE 6. Be well, everyone. Have a great day.